Very happy to be here, and I want to thank Mariella and Jean for the invitation, and I'm very pleased also to see many familiar faces. Of course, this is Switzerland, but it should say Romania. I'm also having two affiliations, so to speak. So as you might know, I've been working in Romania until 3 years ago when I moved to Switzerland. I'm not here to talk about that. I'm here to, at the invitation, to talk on challenges in cancer education, and I'm going to talk about the European School of Oncology experience. So the European School of Oncology, you know this man, I think. He's a great surgeon, a great scientist, as it was discussed previously, a man who published in New England. And he also is a man who created the European School of Oncology 40 years ago. This school was established in 1982 with a very interesting aim: to reduce number of deaths from cancer due to late diagnosis or inadequate treatment. So this was very interesting at the time, because people were very much interested in research and finding new ways of treating cancer. But Professor Veronesi focused on this because of the story of the European School of Oncology. So the story goes that actually the money that we can use today to provide education are coming from a wealthy Italian person who was going around in hospitals for 2 years with chronic back pain. He was seeing a lot of very high-level professors, only to be diagnosed 2 years later with metastatic prostate cancer. And so he said, well, this is unacceptable. This is something that should not happen. I have access to a lot of things, and still I had inadequate care because of lack of education. And it was not because of lack of access to drugs or to examinations or to whatever it was needed back then. So he decided to leave an important sum of money to dedicate on education. So this is what the European School of Oncology is doing, trying to educate. We're not involved in research. We are focusing on the patient and not necessarily on the disease. We are also financially independent, so that means we can establish our own priorities that can include surgery, that can include rare pathologies, that can include countries with limited economic resources. And so that explains also the many activities that we have been doing in Eastern European in countries over the years. We recently celebrated 40 years. This is a cake that we had at the Scala in Milan, and we had a nice dinner, soirée there to celebrate the 40 years of the school. And I'm here now to reflect on those and to try to show you how we've tried to tackle disparities with education, a topic again very relevant to Eastern Europe, and to see if we can learn something from this. So the school, as I told you, we have defined our mission and our vision, and we are an independently funded non-profit organization, and we are dedicated to quality education and training because we believe all patients deserve equal access to competent cancer care. And all these words have their importance because we're not only focusing on education, but also on training, because you need certain skills to be able to take good care of patients. And we also have in our vision that we would like to ensure that all cancer patients have access to unbiased, and this is important, and evidence-based competent care from adequately trained health professionals. And that's why we are keeping our independence, and we are trying to provide the best information for our alumni. So returning to the start of the story, I am always showing this slide. This slide is a 5-year survival from breast cancer across Europe and in European countries. And these countries are represented as dots, and they are clustered by color. So in red, you see Eastern European countries. In yellow, you see Northern European countries, and in blue, let's say Central European countries. That would be probably Austria, etc. So when you look at that, you see there is actually a 15% difference in 5-year survival, and that is simply unacceptable. And I've talked to Claudia Alemani and to the others who are producing this data, and they are analyzing the new ones, and still the gap is there. Still we see the same huge 5-year survival, 15%, that's huge. We don't get that with any drug, with anything. And that's simply because if you take into consideration, this is example that I'm always saying, you know, a patient that is diagnosed and treated in Cluj, where I was in Romania, if he travels 500 kilometers to the west, his survival would improve by 15%. And that's somewhat not acceptable in the European Union, where we say we want to offer equal rights to all European. So why is that? And I think there are many factors that account for cancer outcome disparities. And I think there's the general population, health and lifestyle that differs from one place to the other. It's the health system infrastructure, access to general health issues, systems for many other diseases other than cancer. It's about late-stage diagnosis and presence or lack of screening. It's about the cancer care infrastructure, the people that are sitting around this table and trying to do their best, no, the cancer care infrastructure refers to actually access to good quality surgery, good quality radiotherapy, but then it comes also the cancer workforce, that is the people that have to man the machine, that have to provide care to the patients. And there are disparities regarding all this. There's also patient access and availability of cancer medication, but that's only one part of the whole complex. And I think we need to take those into consideration when you look at what is the situation in screening, and this is data from 2016. You see there are many countries in Eastern Europe that do not have a screening program on breast cancer. I'm giving you this example. Regarding access to medicine, I've worked with ESMO on availability of drugs, and we've showed that there's a big discrepancy and a lack of access, including to very cheap, inexpensive drugs in certain countries. And we see that problem also today. You know, you are obliged to treat cancer patients without cisplatin and things that are really cost nothing, and you cannot really cure certain malignancies in absence of those drugs. Imagine testicular cancer or whatever. So there are many issues related to access to medicines, but that's not only the focus. I think, and this is another work that we've done with Edo Verdoliak and the group from Eastern Europe, I would say, and many others, looking at the relationship between what you spend and mortality to incidence ratio in Central and Eastern Europe. And actually, there is a link. If you want, if you spend more, you would probably get better outcomes in terms of outcome for our patients. So money are important. It's not only that, because this is not a problem that you can solve with just throwing money at it, because there are many ways of that you need to improve really the connection between the different bits of the system. However, I think there's much to say also about clinical research. We've had a very nice presentation about the role of surgeons, and I think that's critical. But we also, in general, these are cancer trials. It's not only medical oncology, surgery, it's radiotherapy, and you see the discrepancy. Now we're in Bulgaria, and this is data that I've pulled out a few days ago. So in France, in Germany, in Spain, you see there's a tenfold difference, even more, in the number of clinical trials that are open. So I do believe that clinical research is a very good way of educating the medical team and to improve care in a local facility. And that's why I think it is important to highlight that, in fact, the clinical research is still lagging behind in certain areas. So we took all those things into consideration when we constructed our programs, and I'm returning now to the activities of the school. So the school wanted to do something to educate people, and we started doing at first conferences, and it was one example is the Advanced Breast Cancer Conference that Fatima Cardoso is organizing each year. This is the example in 2021, but we will have the next one in November. Many other educational events were done. These are the ABC. There are other conferences that were organized. This is the breast cancer in young women and so on. But we felt that was not enough, because conferences are good. You can discuss new things, you can achieve a consensus, you can issue recommendations, but we still didn't get enough close to the people that are treating cancer there and to try to educate them. So we considered our mission in Eastern Europe is to promote and secure independent academic education, to boost education on multidisciplinary cancer care. And it's always the same word, multidisciplinary, and to try to reinforce the communication among specialists. Multidisciplinarity is not that the patient is circulating from the surgeon to the radiotherapist to the medical oncologist and so on. Multidisciplinary means that those people are in the same room at the same moment, discussing the same patients. They discuss among them, and then they give their recommendation to the patient. And this is still lacking. I think that we also considered our mission to support young oncologists in the region, because you cannot teach an old dog new tricks. And we also thought that it is important to establish leadership programs in oncology. So because education by itself is good, but then you have to be able to change your environment and to be able at a certain moment, once you have the knowledge and you get to be in a position, perhaps a chief, the department chief or something like that, to try to use your political skills and leadership skills to try to influence change and bring about the new things. And also to enforce a professional and scientific collaboration between Balkan countries. So what are our activities? And I'm sorry for those who've participated in our events and already know these things. I didn't know quite well the audience, but I'll briefly present what we do. We do the master classes, which is our flagship event, which is a full immersion, a 5-day course, 4.5 days with international local faculty, about 50 to 80 participants that come and stay there for the full period, and they are multidisciplinary. That means that we accept specialties across the board. There's a competitive application. I have to tell that we have actually a 50% admission rate right now. So we have twice as many applicants for the masterclass than with the places that we have. And that we want to provide an update on the basic principles, but also on advances in the 5 big killers, so to speak, but also with spotlights that are targeting more rare tumor types. And what I also want to point out is that we always offer a tumor board, and we ask our participants to present a case. And I'm still amazed, even we had the last masterclass 1 week ago in Varese, still people are coming to me and saying, well, thank you for that. This was the first time I had to prepare a case and present it in English. And that was a good experience for me. This is what they are saying. So there's still things that we need to do in order to help our people get better. Nonetheless, the masterclasses are fun, and for those of you who participated, they know it's fun. We had different programs. I don't want to do all the history. We had the Western European program, the Eastern European program, we had the Baltic and Eurasia program, we had the Arab World program, then we changed it to the Arab and Southeastern European program. Many things. We've done many events in the last 40 years. After the masterclasses, we still needed, there was a need to a more specific event that would target one tumor type, one of the, let's say, big killers, because there was not time enough during the masterclass, where you only have a half day to discuss lung cancer, to go into the deep knowledge. So therefore, we organize the refresher courses. They are meant for those who participated in masterclasses to upgrade their knowledge and to focus on a special thing, and then to be able to, let's say, become more at home with that knowledge. This is a shorter course, a 2-day course. We've organized many of those. The first one I had the pleasure to organize in Cluj. That was 2014 already. time flies. And so many events. We also have the visiting professorship program, which is, again, the aim is to promote the multidisciplinarity and to support training of young oncologists. And that is when someone will travel to a certain location, be it a hospital or university, and within 1 day and a half, there is an efficient transfer of knowledge between the local key opinion leaders and the external professor to try to improve what is happening on board. And this is usually highly appreciated. We've organized a number of those. I see Alexander, we've done one in Montenegro. First one was back in 2012 in Albania, many others organized since then. So over the last 10 years, we had a look at what we have been able to achieve in terms of training for people in Eastern Europe. And this is a heat map that's showing you the number of participants. You see there Romania comes out quite brightly, but that's just the numbers. And you have here the numbers. You see that so only in the 10 years, we've been able, for instance, in Bulgaria, to have 470 participants from the country. I'm not saying 470 individuals, because some people have done several events, but at least we had 470 participants from this country to our events, and that's a lot. I would say that is a lot. And we also try to see what is the impact that we're having in terms of, we divided the number of participants to the number of cancer cases. Just because you have to correct somehow for the population, you cannot compare the number of people from Kosovo or from Bulgaria or from Poland, which is 40 million people. So we try to find a denominator, and that was a number of cancer cases. So you see there is still a lot of, let's say, interest in our activities from those countries which are in a stronger color. Regarding Eastern Europe, I've organized a retreat back in 2019 with a number of, let's say, leaders, key opinion leaders from the field, from the region, to try to understand what is the need, where do we need to go. And some my take-home points from that meeting were that the curriculum for training in oncology, in surgery, and many other things was not really followed. It was only on paper. That the basic principles of oncology were not really taught, that there was a lack of mentors, leadership, role models for those young people to try to have someone to guide their career. There was a need for fellowships in another center to go out to see, and that is also always something that is very important. Access to journals and textbooks, still a major issue in the area, and there were also need for courses on specific topics for which local faculty did not have enough expertise. And also a message for us that we needed to better advertise our events, because people unfortunately don't read anymore leaflets left in the library. Nobody goes there and tries to get a copy of the last. We used to send by mail small leaflets. That's useless. People are now only social media and all that. So that was a good lesson for us. So what we have done, and I didn't update completely on my slides, but regarding the basic oncology, we've already organized in Ljubljana last year the first basic principles of oncology that took place in October 22. Next September, there will be the next one organized in Bucharest to try to improve this area. In which concerns the lack of mentors and role models, we have introduced a mentorship program within the college, and I'll talk about the ESCO, about the College of the European School of Oncology. So we have now a large number of pairs of mentors and mentees that are working together to try to either have a specific goal of publishing a paper in Ricardo's journal, or to develop a project, or to just get advice on their career. And to try to improve our communication with the area, we have the ambassador program that actually we have now in many countries ambassadors that are promoting our activities in the region. In order to improve the leadership skills of those who already, let's say, are in a position to start changing things, we've already organized last July in Warsaw the Improving Outcomes and Leadership course, and that was one event that was very, very successful. And there are a number of projects that are already showing fruit from that particular interaction between people from the area and faculty. And we also embarked on offering clinical training centers in Eastern Europe, and I'll briefly talk about that in a while. So what is a clinical training center? I think one experience from that many people appreciate in the beginning of their career is going abroad for 3 months, for 6 months, to try to see how others do things, to try to understand, to get out from their comfort zone. And actually we are offering this CTC program, which is 3 to 6 months placement. We give approximately 2,000 euro per month. And we also offer a list of institutions that will accept you. There are some criteria for those who need to, who want to apply, of course. And this is something that is really, really helpful. And this is just a list with the centers that are currently on our clinical training centers. I will show you that we already have 3 centers in Eastern Europe, and we are trying to also influence, let's say, the local metastasizing of participants from Eastern Europe to Eastern Europe in order to perhaps break the language barrier in certain areas. For many years, we have offered online education, and that was long before COVID. We were having the e-ground round sessions where you could connect and actually have access to information. With COVID, everything changed. Now everybody is offering online education, but we do have a very important library of things, and we've organized our educational materials into what we call pathways. So if you are interested in gynecological tumors, you can follow that particular pathway and try to also accumulate credits that will help you for your ESCO career, that I will discuss just a little bit further. And let's say the most advanced educational offer that we have are the postgraduate program. These are postgraduate programs in lung, in breast, GI, prostate, gynecological cancer, lymphoma, and we also have one new one in oncohumanities. These are 2 years program that we have developed in collaboration with certain universities, Ulm, Zurich, and the University in Ticino, Università della Svizzera Italiana, and these are longer programs. Mariella can tell you she is enrolled in one in a certificate of competence for breast. She can tell you more about how it works and how it functions. But this is, in truth, a very good certification of your training in a specific area, and it will give you a university certificate for your specialization. Regarding, I was telling you about the basic principles. In oncology, we had the first one in October. It was highly successful. We had a number of people, and I do think that this is still a need today. It's very easy to get the latest news from ASCO or from ESMO on the new targeted agents, but people forget to discuss the basic principles. Why do we need surgery? What are the principles of surgical treatment, radiotherapy, how to combine drugs, etc. So to give you the basis on which you can then, of course, build all the new things that are coming along. But I think we are also moving very rapidly into an area where we will not always have a clinical trial to answer our question. So we will have to use what we know to make a decision for the individual patient, because we will not have a perfect clinical trial that will answer, okay, this patient received A and B treatment, what do we do next? So you'll have to know and to put that into perspective. And I think that's why I think this course is very important. I've talked a little bit about the Leadership and Improving Cancer Outcomes course, and I think that is not necessarily a course. It was really a meeting of faculty and young leaders from the area that exchanged and tried to put together a project. I think this is also a very promising new program that we have, and we want to continue to offer it. So in terms of outcomes, we've published a number of papers, and Professor Pavlidis has been the engine behind this. I think I will not go into the details, but there are several articles in which we review our experience with the masterclass, with, we have looked at numbers, what are the participant number, which countries, etc. I will not bother with that. But for the last maybe 3 minutes, I will talk on the college, on ESCO. And this is a new creation, and I was actually, I'm in charge of managing the college. So ESCO is the College of the European School of Oncology. And what is actually this? Well, this is a repurposing of the activities that we have. We understood that we offer different activities, but it's very important to offer a career development pathway for someone who's really interested in developing their career, and to give an order to the events that we are organizing. I will not go into the details, but that's how we think a candidate should, let's say, participate in our events. To start with, we also have the medical oncology for medical students course. So maybe that's the first element when you start understanding a little bit. Then you go and do the basic oncology. Then you go to the masterclass. Then you do 1 or 2 refreshers. Then you understand you need to go abroad. Then you do a fellowship. And then once you decided, okay, I want to do breast cancer, then you enroll and do the certificate of competence. And now you are very well accomplished in your, let's say, educational and oncology skills, but then you need something more to be able to go back to your country and change things, and that's perhaps the leadership and improving outcomes course. So the college is divided into three levels. Every person who participated in one of our events that had a competitive application is eligible to apply to become a member of the college. So once you have been accepted, and I remind you that we have this rejection rate of 50%, then you become an ESCO student, and then you start accumulating credits. And each activity that you're doing brings you credits. And there are 3 levels. You see student, fellow, and graduate. And you need to accumulate 100 ESCO credits to become an ESCO fellow, and then you need 500 ESCO credits to become a graduate, and then you finish. And so credits are earned by doing our activities, but also by professional achievement outside the school. That is publishing, that is having abstracts at conferences, that is passing an exam, a certification exam in surgery, in medical oncology, whatever, and those are all counted in. And I think this is quite successful for the moment, because we also offer benefits. At each level, we have different benefits that are offered to our members. And this is a list. I will not go into the detail. I will just highlight a number of them. Science Direct subscription, which gives those members access to the journals which are in Science Direct. And I think this is still something that is important and useful for our students. They get priority selection for the clinical training centers, the fellowships abroad. We offer each year for this 2-year certificate a scholarship, because those are programs that are paid and they are quite expensive. So we offer 1 scholarship for each of the certificates to one of our ESCO member, and we also have the mentorship program. So I think in summary, I would say that we have proved our commitment towards independent quality education over the 40 years. I think that the good results, we have seen good results on long term and focusing on the individual. We are interested in taking someone and following him along his career to try to help him get the maximum from his education. We have a commitment to help in limited resource settings, and I think we have also several initiatives that are going to improve our presence and impact in the career development. So with that, I thank you very much for your attention, and I invite you to visit our website for more information. Thank you.